Roseville Police Department is taking new steps now to protect the public.
It allows us to get the medication to them as quickly as possible to hopefully save lives.
Officers are now being trained to quickly act if someone is overdosing on drugs.
They're the first agency in the area to have an anti-opioid drug on hand and ready to use in case of an emergency. CBS 13's Macy Jenkins is live in Roseville for us tonight, getting answers on how this new tool will be used by officers. Macy.
Adrian and Sam, oftentimes police are the first to respond in an overdose situation, and there's not enough time to get to the hospital. But having an anti-opioid drug handy could be the difference between life and death.
Out in the field, first responders have to be prepared for anything.
We never know what we're going to get dispatched to. An
erratic driver, an incoherent pedestrian, or a person who's simply not responsive.
And we come up on them and they're under the influence of, our narcotic.
Now, Roseville police officers have this at their fingertips, a dose of Naloxone, commonly known as Narcan, a quick way to save someone from overdosing on an opioid drug like heroin or painkillers.
We would come up, simply just put the end of the device into their nose and squeeze the syringe part of it.
Within seconds, it increases your heart rate and stops the body from absorbing the drug. But how do officers know who to give it to? Sergeant Jeff B. says they look for signs like heavy breathing, pinpoint pupils, and drug paraphernalia like syringes nearby. But as convenient as it sounds, we wanted to know, is it risky to give Narcan to someone who's not overdosing?
It doesn't matter who you give it to. It's going to be safe to give to those people, even if they're not experiencing an overdose.
Roseville PD is one of about 12 agencies in the state to have the drug on hand.
So there's agencies in Orange County, the Bay Area, here in Sacramento that are starting to roll this out.
Sean Rundle with California Peace Officers Association says San Diego County Sheriff's Department became the first in 2014.
We're even getting some donations from local hospitals for us to carry it.
Each dose costs about $45. Roseville purchased its doses with grant money, and Rundle hopes the city can set the standard for others in Northern California.
I think it's good because I think other agencies are going to look to see how it's going for them.
Now, Sergeant B says if you have a family member who is an addict, you can actually request a prescription for Narcan from the doctor and then ask them to train you on how to use it in an emergency situation.
Macy, thank you very much. Live for us tonight in Roseville.